Have you ever felt that annoying itch on your scalp, only to find telltale white flakes on your shoulders? You, my friend, might be dealing with dandruff. Dandruff, also known as seborrheic dermatitis, is a common scalp condition. It causes flaking of the skin. These flakes are often itchy and can be embarrassing. But don't worry, dandruff is not contagious and can be easily managed with the right approach. Millions of people worldwide experience dandruff. It's a widespread concern that affects both men and women. Many factors contribute to its development. These include skin type, stress levels, and even the weather. Don't let dandruff make you feel alone or self-conscious. It's a common issue, and there's no shame in seeking help. Understanding the causes is the first step toward effective management. Now let's dive into what causes those pesky flakes. Dandruff is a common condition that affects many people, but understanding its root causes can help in managing it effectively. One major culprit is an oily scalp. When your scalp produces excess oil, it can create an environment that is conducive to the growth of certain microorganisms. Excess oil can create an environment where a specific yeast, called Malassezia globosa, thrives. This yeast is naturally present on everyone's skin, but it can become problematic under certain conditions. This yeast is naturally found on our skin, but an overgrowth can lead to dandruff. When Malassezia globosa breaks down the oils on your scalp, it produces byproducts that can irritate the skin, leading to flaking and itching. But oily skin isn't the only trigger. Dry skin can also lead to dandruff. When your scalp is too dry, it can become flaky and shed skin cells more rapidly than usual. Dry skin can also lead to dandruff. In this case, the flakes are usually smaller and less oily. This type of dandruff is often exacerbated by cold weather and indoor heating, which can dry out the skin even more. In this case, the flakes are usually smaller and less oily. People with dry skin may notice that their dandruff worsens during the winter months when the air is less humid. Other factors include sensitivity to hair care products, infrequent shampooing, and certain medical conditions. Some people have a scalp that is sensitive to certain ingredients in hair care products, which can cause irritation and flaking. Infrequent shampooing can lead to a buildup of oils and skin cells, which can also contribute to dandruff. Additionally, certain medical conditions such as psoriasis and eczema can cause dandruff-like symptoms. Understanding these various factors can help you identify the best way to manage and treat your dandruff. When we talk about oily skin and dandruff, we can't ignore Malassezia globosa. This tiny yeast feeds on the sebum, or oil, produced by our scalp. While it's a normal resident of our skin, an overgrowth can irritate the scalp. This irritation leads to the increased production of skin cells, which clump together and form the visible flakes we know as dandruff. Managing oil production and controlling the yeast are key to tackling this type of dandruff. Section 5. Dryness, stress, and other factors. More to the story. While oily skin is a common culprit, dry skin can also be a significant factor in the development of dandruff. When the scalp is dry, it can become irritated and flaky, leading to the formation of those pesky white flakes that we commonly associate with dandruff. This type of dandruff is often worse in winter when the air is drier. The cold, dry air can strip the scalp of its natural moisture, exacerbating the dryness and flakiness. Stress also plays a significant role in the condition of our scalp. It can disrupt the body's natural balance and worsen dandruff. When we are stressed, our body produces more of the hormone cortisol, which can lead to an increase in oil production on the scalp. This excess oil can mix with dead skin cells, creating an environment where dandruff thrives. Other contributing factors include certain medical conditions like psoriasis, eczema, and Parkinson's disease. These conditions can cause the skin to become inflamed and irritated, leading to an increase in dandruff. Psoriasis, for example, causes the skin cells to multiply too quickly, resulting in thick, scaly patches that can flake off. Eczema, on the other hand, can cause the skin to become red, itchy, and inflamed, which can also lead to flaking. Parkinson's disease can affect the body's ability to regulate oil production, leading to an increase in dandruff. Understanding these various factors can help us better manage and treat dandruff, ensuring a healthier scalp and more comfortable life. Section 6. Types of dandruff. Not all flakes are created equal. Dandruff isn't a one-size-fits-all condition. It can manifest in different ways. The most common types are oily dandruff, dry dandruff, and dandruff due to other skin conditions. Oily dandruff is characterized by large, yellowish flakes and an oily scalp. Dry dandruff presents as smaller, white flakes and a dry, itchy scalp. Dandruff due to conditions like psoriasis often appears as thick, silvery scales. Section 7. Fighting flakes, effective treatment options for dandruff. The good news is that dandruff is manageable. There are various treatment options available, from medicated shampoos to natural remedies and lifestyle changes. The key is to find what works best for your specific type of dandruff. Anti-dandruff shampoos are often the first line of defense. These shampoos contain active ingredients that target the underlying causes of dandruff, such as yeast overgrowth or inflammation. The power of shampoo. Choosing the right one. Not all anti-dandruff shampoos are created equal. Different shampoos contain different active ingredients, targeting specific causes. Some common ingredients include zinc pyrithione, selenium sulfide, ketoconazole, and salicylic acid. It's essential to choose a shampoo that addresses your specific type of dandruff. If you're unsure, consult with a dermatologist or a pharmacist for guidance. Natural remedies. Soothe your scalp. Alongside medicated shampoos, natural remedies can provide relief and promote a healthy scalp. Tea tree oil, apple cider vinegar, and aloe vera are known for their antifungal and soothing properties. However, it's crucial to dilute these ingredients properly before applying them to the scalp to avoid irritation. Always do a patch test on a small area of your skin before full application. Lifestyle changes. A holistic approach. Managing dandruff often involves more than just topical treatments. Lifestyle changes can also make a difference. Managing stress through techniques like yoga or meditation can help regulate the body's response and reduce flare-ups. Maintaining a healthy diet rich in fruits, vegetables, and omega-3 fatty acids can also improve scalp health. Additionally, avoid scratching your scalp excessively, as it can worsen irritation and lead to further flaking. When to seek expert help. Don't ignore persistent dandruff. Dandruff is a common scalp condition that affects many people, but persistent dandruff can be a sign of a more serious issue. While most cases of dandruff can be managed with over-the-counter treatments and lifestyle modifications, such as using medicated shampoos, reducing stress, and maintaining a healthy diet, it's essential to seek professional help if your dandruff is severe or doesn't improve with home remedies. Persistent dandruff can sometimes be a symptom of underlying skin conditions like psoriasis, eczema, or seborrheic dermatitis. If your dandruff is severe or doesn't improve with home remedies, it may be time to consult a dermatologist. They can provide a thorough examination and determine if there are any underlying conditions contributing to your dandruff. Additionally, you should seek help if you experience pain, bleeding, or oozing from your scalp. These symptoms can indicate an infection or a more serious skin condition that requires medical attention. Another reason to consult a professional is if the dandruff spreads to other parts of your body, such as your eyebrows, beard, or chest. This can be a sign of a more widespread skin condition that needs targeted treatment. A dermatologist can diagnose the underlying cause of your dandruff and recommend the most effective treatment plan. They have the expertise to identify whether your dandruff is due to a fungal infection, an inflammatory skin condition, or another issue. Once the cause is identified, the dermatologist can recommend the most effective treatment plan, which may include prescription-strength medications, specialized shampoos, or other therapies tailored to your needs. Prescription-strength medications can be more effective than over-the-counter options, especially for severe cases. These medications can help reduce inflammation, control fungal growth, and alleviate symptoms more effectively. Other therapies may include light therapy, topical steroids, or antifungal treatments, depending on the underlying cause of your dandruff. By seeking professional help, you can ensure that you receive a comprehensive treatment plan that addresses all aspects of your condition, leading to better management and relief from persistent dandruff.